adopt a healthy and positive approach to daily life. Here are a few friendly reminders.
When you go to the local market and food vendors, remember to maintain a social distance of 6 feet or 2 meters apart. And always wear your mask.
Always keep your hands clean. Wash your hands with soap and water or hand sanitizer. When dining, choose restaurants with staggered seating. This will lower the risk of transmission.
If you have a fever, cough, or other respiratory symptoms, please wear a mask and seek medical care immediately. Rest at home and do not visit the food vendors, local markets, or restaurants. Together,
We can create
A safe environment and embrace
a border reopening lifestyle.
Thanks to the nation's unified response,
is on.
Good day and welcome to the National Emergency Operations Center COVID-19 weekly briefing for the 11th of November 2020. We thank you very much for joining us today, as you usually do, so that we can keep you informed as to how we are managing the COVID-19 pandemic here in St. Kitts and Nevis. The pandemic is still with us many months later. And of course, your presence with us at these briefings is important because it's an all-of-society approach as we continue to manage the COVID-19 pandemic here in St. Kitts and Nevis. So thank you again for joining us. I would like to invite, firstly, Superintendent Cromwell Henry, Divisional Commander for District A, to give us his presentation with respect to the law. Superintendent.
Thank you, Mr. Williams. Pleasant good afternoon to all listening to this broadcast by whatever means. At a meeting with the event promoters and entertainers on November 7th, the Commissioner of Police and the National COVID-19 Task Force engaged in a healthy exchange of views on the issue of hosting public events, especially those that attracts large crowds. The CMO explained the risks of exposure to the virus now that our borders are reopened, and the need for authorities to carefully manage large crowds in public spaces. The current emergency powers regulation restricts all social activities and requires organizers to first seek permission in writing from the Commissioner of Police. As a precaution, therefore, and until we are comfortable that all the entry and quarantine protocols are satisfactorily in place and all the gaps are filled, permission for events over the next 30 days will be very limited. We continue to urge residents to be conscious of your own health and adhere to all the protocols. These are social and physical distancing, wearing of face masks in public spaces, and good hand hygiene and sanitization practices. Speaking of being conscious of your health, over the last weekend, a resident visited a high-risk traveler who is quarantined at one of our designated quarantine sites, and despite being warned by the security personnel on duty, the young lady came in close contact with the person who is in quarantine. Out of an abundance of caution, the CMO, who is the quarantine authority, directed that the young lady be quarantined in the interests of public health. She is now at another designated quarantine site for 14 days at her own expense. Regulation 14 of the Emergency Powers Regulation provides no person shall visit or be permitted to visit any place of quarantine or isolation station. Properties where persons are in quarantine or vacationing in place have separate areas demarcated for such persons. All other unauthorized persons are prohibited from accessing these areas. Hotel security and compliance and quarantine officers are on duty at these locations to enforce the restrictions. We ask for the full cooperation of the public when using these facilities. Remember, the restrictions are in place to protect you, and so we ask that you protect yourself by not violating the restrictions and comply with whatever directions the quarantine officers or compliance officers may give you. Thank you.
Thank you very much, Superintendent Henry. I will now invite Mr. Abdias Samuel, who is the chair of the COVID-19 National Task Force and the National Disaster Coordinator, to give us his presentation.
Good afternoon, all viewers, listeners, by whatever means. Welcome to this another briefing of the NEOC and the COVID-19 Task Force. And thank you, Mr. Williams. On Saturday, 7th November, we would have experienced the arrival of our first major commercial flight, that is the AA318. The flight would have landed in St. Kitts at approximately 3:17 p.m. and would have reached on its block at 3:21 p.m. The Ministry of Health would have received the first passenger at about 3:28 thereabout. At the screening point, we would have averaged approximately 1.1 minute for each passenger. So at the screening point, it would have taken approximately 1 hour and 30 minutes to screen all 81 passengers. And I think this was impressive, as we will ensure that this will increase. So, sorry, the time will decrease to ensure we have a more smoother process. The last passenger would have entered the health screening area at about 4:23 p.m. It's important for us to monitor these timing to see the flow process and for us to improve this process going forward. The last passenger would have exited customs and boarded a taxi at approximately 5:50 p.m. on Saturday. So the arrival process took approximately 2 hours and 33 minutes from the entrance into the hall to the last taxi leaving with incoming passengers. And I want to commend the St. Kitts Tourism Authority for the thorough guidance and the thorough coordination of the ground transportation. There were a total of 29 taxis operating on Saturday. These were COVID-19 certified taxis that would have gone through the training process and would have retrofitted their vehicles to be able to be compliant and COVID-19 certified. And how do you know if a taxi is COVID-19 certified? They have a travel approved seal which looks like a small suitcase with two dumbbells to the side. And this is the seal that is given by the St. Kitts Tourism Authority after the vehicle would have been inspected and validated for use for COVID-19, for high-risk passengers. So kudos to all of those operators. Now, those operators would have received an average of 2 jobs, on Saturday, and the fares would have ranged from $16 to approximately $28 per person, and additional cost for baggage and animals, etc. The process was well coordinated. So now from the health screening process, you would have gone to the immigration department where the new form, the KNA travel form, is being utilized. So if a traveler did not complete the KNA travel form, then this traveler would have been processed using the old system. However, what the KNA travel form does, it gives us the opportunity to filter individuals and allow the authorities to verify documentation process in a more efficient and quicker way. So I want to commend the Miss Ophelia Blanchard and Travel Morris for the great work they did with the travel form. It's a critical tool that's going to help us in the fight against this COVID-19 pandemic. From the immigration area, which was one of the fastest stations on Saturday, persons would have then proceeded to the customs area. At the customs area, there was tremendous work done there for the retrofitting process. So no longer you will walk up to a customs officer and interact face-to-face. Customs officers are behind booth, and if there's a need for a secondary screening process where your luggage will be screened, then there's a particular area designed to protect the customs officer, protect the traveler, and your bags to be able to be screened safely. Upon exiting customs, then on the outside you are met by a dispatcher. So the dispatcher will meet you, you will queue if the line is already, if they're already engaged, and then a number will be given of the taxi operator that will take you to your destination, meaning your place of abode. And that receipt, the name of the taxi, the registration of the taxi, and the taxi fare will be listed as amongst other information on this receipt. So therefore, no one can actually overcharge, and the persons can understand that this is what you will pay for this trip. All this is a means of controlling. Remember, we kept talking about the corridor of containment. So this provides the opportunity to do traceability or contact tracing in the event that there's a potential outbreak or there's an outbreak. Now, I want to basically give you an idea of how the accommodation would have gone. So Four Seasons Resort on Nevis would have received 8 international visitors, while the Ocean Terrace Inn would have received 11 nationals. Wally Beach Resort would have received 4 nationals. Park Hyatt, 10 international visitors. Potworks on Nevis, which is a government-designated quarantine facility, 7 nationals. And the Royal St. Kitts Hotels would have received 10 nationals, 2 visitors, and 39 students who would have returned. In those 39 students, we would have had students from the Ross University and other universities and our locals. So the total arrival of flights into St. Kitts and Nevis since our borders have opened, we have on St. Kitts arrival 35, departures 34. That's commercial flights. On Nevis, you would have had 30 arrivals and also 30 departures. For cargo flights from the 31st to the 9th of November, St. Kitts would have received 30 cargo flights inbound and 30 outbound. Cargo flights are Nevis, 12 inbound and 12 outbound. Therefore, the Federation would have experienced a total of 65 inbound commercial flights and 64 outbound. Again, 65 inbound and 64 outbound. And cargo, 42 inbound, 42 outbound cargo flights. We have been experiencing some heavy rains, and again I want to appeal to the general public to continue to be vigilant and monitor the weather notices that are being provided by our local Met office. And again I want to thank Mr. Elmer Burke for his proactiveness and in ensuring that we receive the necessary vital information. St. Kitts and Nevis and also along with the Leeward Island is under a flood watch, meaning that flood conditions are possible. The rain will be continuing for the next 24 hours with the potential of us receiving 1 to 4 inches in the Leeward Islands, St. Kitts and Nevis included. Weather tonight, we have a 90% chance or a very high chance of periods of rains and a 30% chance of a low chance of thunderstorms. Please be vigilant, be mindful in traversing in known waterways or areas that are prone to flooding. Also, be mindful of areas that are prone to rock slides, such as the Old World Bay area, or areas that are prone to landslides. It's very important that you don't park in these gutways or waterways overnight. You may wake up in the morning and find your vehicle somewhere else. Again, we want to appeal to the general public that now that our borders are open, you have to be more vigilant. Please ensure that you wear your mask, avoid social gathering, adhere to the protocols as outlined in the regulation. These are very critical for us to remain resilient. As we have seen in many other countries, once you open your borders, you open your borders to the virus entering the Federation. As yet, we don't know if any one of the 101 passengers or 102 passengers that have arrived will turn out to be a positive case. However, we are hopeful that all the systems and mechanisms put in place would be able to assist us in keeping St. Kitts and Nevis safe. I want to highlight one critical thing that we experienced over the weekend, on Monday, Tuesday, thereabout, is misinformation. I am appealing to all media houses to exercise responsible journalism. At this point in time, we have done a good job in ensuring that misinformation is not used to create panic or fear in our people. Before reporting an information or rumors or fake news, as it's popularly called, please ensure that you do your investigations. Feel free to contact the Ministry of Health, contact the National Emergency Management Agency, the police force, or other relevant agencies for vital and credible information before doing any reporting. Remember, at the end of the day, you are creating panic in the Federation. You are also affecting the product of St. Kitts and Nevis as a safe haven and as a very good tourism product. So therefore, I am appealing that we do our best to ensure that we fight against the virus, but most importantly, against misinformation. It calls for responsible journalism, responsible information sharing. I also want to appeal to the business places. I want to appeal to the business places to continue the enforcement. The compliance teams are out in their numbers, they are doing their job, and we need you to be supportive of their efforts Please ensure you have your sanitizing agents. Please ensure you have your markings in place. Please ensure you have the necessary signage whereby you indicate to the general public, in particular your customers, what is required for you to access your services. Also, safeguard your staff and safeguard your customers. And by extension, you're safeguarding the country. Thank you very much, and I do look forward for your cooperation.
Thank you very much, Mr. Samuel. I now invite Dr. Hazel Laws, the Chief Medical Officer, to present us with the Health Emergency Operations Center Situation Report.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. As per usual, my task is to share with you the situation report from the Health Emergency Operating Center. And as we are all aware, St. Kitts and Nevis has only reported 19 confirmed cases of COVID-19 to date, and they've all recovered. And thankfully, we have no deaths, 0 deaths so far. Globally, based on the World Health Organization's dashboard, 50.8 million persons have been confirmed with COVID-19 to date. And with regards to the death toll, there are 1,263,844 deaths reported so far from COVID-19. In terms of the United States of America, the number of confirmed cases continue to surge. There are 10,260,282 confirmed cases, and the death toll also continued to rise, 239,695 deaths so far. What's happening in the Caribbean region? We have almost 283,000 confirmed cases within the 33 territories in the Caribbean region. And in terms of the death toll, 4,614 deaths so far. The next slide gives you an idea as to what's happening in each of our member states. Jamaica is out at the front with almost 10,000 cases, Bahamas almost 7,000, Trinidad and Tobago almost 6,000, Guyana 4,530, and in terms of the islands closer home, this just gives you an idea as to what's happening. In St. Lucia, the number of cases continue to rise, and I think yesterday they would have reported their first death as a result of COVID-19, and they also stated that there are 2 more who are critically ill. So we pray for their recovery. So that's in St. Lucia. In St. Kitts and Nevis, we continue testing those who would have come into country from hotspots, and this includes our returning nationals and the tourists who would have come into the Federation since our borders are open. So far, we've tested 3,369 persons. And in terms of quarantine, because we would have accepted persons since our borders are open, we now have 186 persons in quarantine. And in terms of the pre-approved quarantine facility, we have 5. And so these are homes that were evaluated and approved as pre-approved sites, and they have signed on to the security facility. So we have 5 in that category. So, ladies and gentlemen, this slide shows the website for the entry form. And so if you have relatives, friends, loved ones who are planning to return to the Federation, you would need to direct them to this URL or website, www.knatravelform.kn. knatravelform.kn. So as I speak, just pull out your phone, your smartphone, and log on. Just plug in knatravelform.kn, and then you will see this nice electronic booklet. This provides you an overview of the health and travel protocols. It would help you in terms of completing the entry form. And so this form requires details, specific details necessary for the Customs Department, immigration, and health. And so there are some questions that are, health related, really asking you if you are exhibiting any of the COVID-like symptoms. And so we also want you to upload a negative PCR test, COVID-19 PCR test. And so before coming to St. Kitts, you are asked to do this test. Make sure you get it done within 3 days of travel. So you go, let's say you're traveling to St. Kitts Saturday coming, so you would have gone to the lab this morning, Wednesday morning, to get your PCR test done. Hopefully you get your results later today or even tomorrow, Thursday, and you are to upload the negative COVID-19 PCR test result onto the form. The PCR test must be done at an accredited lab. And the reason for that is we do not want anyone submitting any fake results. Please note that the team that's working on this entry form and the approval process, they take the time and they research the lab and they verify the authenticity of the COVID test result that is uploaded in by each applicant. So inbound travelers will only be granted permission to enter having submitted a negative COVID-19 PCR test, which would have been done within 72 hours of travel. And we also want you to provide us the evidence of your reservation. So each inbound traveler, you are asked to make a reservation at the hotel or the accommodation site. And we want you to provide us with the confirmation of this reservation. All right? Please note there are individuals that are submitting fake reservation codes. Please note that the team verifies the reservation, the evidence that you would have submitted to make sure that you really do have a reservation at the hotel you claim that you will be staying at. All returning nationals, residents, work permit holders, and international travelers will be monitored during the first 14 days of stay in the Federation, or less if your duration of stay or if your vacation is less than 14 days. Please note that you will be undergoing serial testing, tested on day 7 and on day 14. If, however, your duration of stay or your vacation is 7 days or less, you will be required to do a PCR test 2 to 3 days prior to departure from the Federation. All returning nationals, residents, work permit holders, and international travelers are expected to adhere to the COVID-19 prevention and control measures while on island. So those of you who are here who would have just come back, please note that you are required to wear your mask, face mask in public spaces. You are expected to maintain a distance from locals while you are being monitored during that 14 days. And you are expected to keep your hands clean, hand sanitization. This is very, very important because the compliance team, they are observing your behavior. And if there is any breach, there are consequences. And then those of us who are here in the Federation, we also have a responsibility in terms of preventing a second wave of infections. So let's back up. Each of the countries who would have opened their borders and have accepted international travelers, we've seen a surge in the number of cases. And so I want us, we want our experience, or we are hoping that our experience is different. And we can try, we can make a very strong effort, such that this is not our experience. And how can we achieve this? Can I have the slide that you just left? Right. We can do so by each of us wearing our face mask when in public spaces. We can do so by avoiding crowds and these super spreader events. Very, very important. Maintaining a physical distance of 6 feet between ourselves and others, and maintaining adequate sanitation, adequate hand hygiene. These are the measures that have proven very, very effective in curtailing the spread of this virus from one individual to another. When you look at what's happening in St. Lucia, I mean, that article that, in which we saw the report of the first death, the Prime Minister, said, look, this virus spreads very fast. It's highly contagious. And so we need to be aware of that and adhere to the recommendations. Wear your face mask, wear your face mask, wear your face mask. Some additional information. This just came out a few days ago. Pfizer and BioNTech, they've reported that their vaccine candidate is very promising. And so this is a vaccine that's being developed by Pfizer and BioNTech. It's being tested on almost 44,000 persons in 6 countries. This vaccine, if successful, it would have to be given in 2 doses, 3 weeks apart. So far, they are claiming that they are seeing 90% protection. They are claiming that it provides 90% protection within 7 days of receiving the second dose. But let's be cautious. We've only had, there's only data on this preliminary information is based on data on the first 94 volunteers who would have developed COVID-19. So it's still early days yet in terms of, confirming the full effect of this vaccine. All right, so the 2 companies say that they're well poised to supply as many as 50 million doses by the end of this year. The UK has ordered quite a bit, almost 10 billion and more, 10 million and more. There's one point or factor to note about this vaccine is that it has to be kept in ultra cold storage at below -80 degrees centigrade. So there's going to be some challenge in terms of maintaining the cold chain in distributing this vaccine. All right, so please note that there are about 12 vaccine candidates that have reached the final stages of testing, or the phase 3 stage of testing. So this is just a bit of information regarding the availability of COVID-19 vaccine. Dengue, we're getting a lot of rain now, and so it would be irresponsible of me if I don't remind you that we need to make sure we use good mosquito repellents. The rain is falling, but we need to go out and make sure there isn't any stagnant standing water in and around our homes. Make sure our windows and doors are well screened. Wear appropriate protective clothing. All of this is in an attempt to prevent a dengue outbreak. Our neighboring islands, they have seen a surge in the number of dengue cases recently. Thank you.
Thank you very much, Dr. Laws. While you were speaking, somebody sent me a press release from the Department of Health and Wellness in St. Lucia, which said that the second death of COVID-19 was recorded last night, and it was a 78-year-old male. So St. Lucia has now recorded 2 deaths. We are now at the question and answer segment of this briefing, and I will start off with the first question, which has to do with what you ended on, Dr. Laws, the vaccine from Pfizer. I read recently of a vaccine that was more than 90% effective. This sounds like good news, but will we be in a position to get this if and when it comes on the market? Dr. Laws.
And so, yes, Mr. Williams, it's good news, but we need to be cautious because the researchers are still trying to determine all the facts about this promising vaccine candidate. So let's be cautious and wait until the full report becomes available. I think I read that the full report on this vaccine will become available towards the end of November. So if, well, let me just go on by saying that the St. Kitts and Nevis, our federation, we are participating in the COVAX facility, which is a global facility. You know, it's open to almost every territory in the world, and so we have signed on to this facility, and we've already paid our down payment, and so this will afford us access to a successful vaccine, meaning afford us, the Federation, access to a successful vaccine.
Our second question, this pandemic has affected some more than others. I speak specifically now for the entertainers and event planners. This time of the year is when we make our living to support our families. When is the task force going to relax the restrictions so we can have events, enjoy ourselves, and make a living? Dr. Wilkinson.
Yes, this pandemic has affected all of us, and some persons are feeling the squeeze more than others, but we all have to make a sacrifice, and we all have to try and get through this together. We have reached this far. You heard that so far we've not had any deaths, and all of our cases have recovered. And we need to continue what we have been doing to keep our people safe. We speak about striking a balance between life and livelihood, which means you trying to stay alive while trying to make a living. And we know that the things that make this virus spread, the 3 C's, crowded places, close contact, and being in a closed space. And most of the times when we speak about entertainment and events, these are events that are held either in crowded places. People have to come together, or they're in close contact. And these are the things that we have to avoid, because these super spreader events are what cause the virus to hitch a ride from one person to the other. So we understand your pain, we understand that you're suffering, but hopefully we'll all get through this together. And so the task force cannot relax the restrictions that we have on the super spreader events, and then we end up like some countries with community spread. So we're asking you not to have any COVID fatigue. We'll get through this together. Thank you.
Thank you, Dr. Wilkinson. The third question: every Caribbean country I know that has opened has had a spike in cases. St. Lucia, that was recently being seen as the ideal model when they reopened, is now having what looks like community spread and has now recorded 2 deaths. The CMO said at a press conference before we opened our borders that the virus is coming. Will we be heading down the same road as St. Lucia and the others now that our borders are opened? Dr. Wilkinson.
From the time we had our first press conference here, before the virus came, we said that it was coming. The virus came, it affected 19 persons, and all 19 have recovered. And we have 0 cases on the books right now, but our borders are open. And yes, the CMO had a very graphic picture there with, I think, a plane coming, and said that the virus was coming. And yes, I do believe the virus is coming, and the virus might be here. Now, whether or not we end up like St. Lucia or Jamaica or Trinidad or those places that have community spread depends on your action. It also depends on mine, because we said that the virus cannot move from point A to point B without your help. And that is why we cannot overemphasize the point that you need to do what we have been saying and asking you to practice for the last 7 months. And so once you wash your hands, you stay far from someone, you practice the cough etiquette, etc., you avoid the super spreader events, we can control this. And as we move into the Christmas carnival season, we've been hearing about carnival events that are going to be mainly virtual, but with some in-person events. We need to make sure that we don't get carried away and we come out of Christmas and December, and in January we end up the way St. Lucia is or Jamaica is. And so we're just asking everyone to exercise the personal responsibility and make sure that we contain this virus. So even if 1 or 2 or 3 or even 10 persons come here with the virus will stay dead in its tracks and will not spread from one person to the other. So whether or not we end up like St. Lucia depends on you, and we're asking you to play your part.
Thank you. This question is from Vaughan Radio in Nevis. Can St. Kitts and Nevis expect any cruise ships for the remainder of the year, since provisions were made for crew and passengers of sea vessels to integrate into society after quarantine and testing? Mr. Samuel.
Thank you, Mr. Williams, and thank you for the question. I'm going to answer it into folds. We don't foresee in the near future that the tourism industry is going to come with a mass tourism of the large number of persons that will be disembarking and seeking services. However, what we are seeing is a smaller trend whereby high-end yachts with minimal amounts of individuals or passengers are seeking to restart in the near future. However, we also have requests whereby some of these cruise ships who have been at sea for a very long time are requesting to either lay over or safe harbor in some of the Caribbean destinations. Presently in St. Kitts and Nevis, we are reviewing a request by the Royal Caribbean Cruise Line for 2 of the vessels to lay over in St. Kitts and Nevis for a period of time under the terms and conditions that will be outlined by the local authorities here in St. Kitts and Nevis. This situation is right now is being deliberated and looked at by the medical team, the National COVID Task Force, and a submission will be made to the Cabinet for the cabinet to consider whether this will be permissible or not. And if this is permissible, this will be done under a very strict and safe condition. So this is what we are seeing at the present moment, that some of these ships are seeking safe harbor, some smaller cruise vessels with minimum number of passengers are seeking to restart in the near future in a very safe way. And also we are seeing the yachting sector actually becoming more alive, and persons are willing to make that trip over to the Caribbean with small numbers for persons to be able to start that industry. I think that is what you will be seeing more of in the near future, as opposed to the 5,000, 4,000, 3,000 cruise passengers vessels arriving into the Caribbean region. So that is what we are seeing in terms of the requests right now.
There's another question from Von Radio, but I want to put a disclaimer that I cannot corroborate the incident that is in this question. An incident occurred in Grenada earlier in the week where a certified U.S. doctor and his wife visited the island and was placed under home quarantine. While in quarantine, both the doctor and his wife, while awaiting their results, decided to leave the residence they were staying and visited 4 restaurants. The results then turned out to be positive for both. Currently, the health department is doing contact tracing, where it is said that dozens are now in quarantine. Do we have anything in place to prevent such an act in St. Kitts and Nevis? Do we have enough security in place for every passenger that decides that they need home quarantine? Mr. Samuel.
Thank you, Mr. Williams, and I'm very happy that you brought up that question. And yes, I have seen this article about those 2 American visitors in Grenada that did not wait for who were in home quarantine, and they did not await the test that was done on the day before they would have exited their place of abode. They did visit some bars or several restaurants, as the article would have depicted. And yes, there are several persons who have been now quarantined as a result of their actions. In St. Kitts and Nevis, that is why we will continue to do the necessary quarantining. For example, we have the pre-approved quarantine facility, and part of that criteria is for you to have security that will be prescribed by the Office of the Commissioner of Police for 24 hours for the length of your stay in quarantine. And also the government designated quarantine facilities are manned with compliance team members and also our local security forces for this particular reasons. And I can say to you and the general public too that once these persons are tested, the security forces are notified, and that's the only way they will be able to leave these facilities. Also, persons who are vacationing in place, unless the authorities to the Ministry of Health in collaboration with the hotels and their securities also would be informed, and nobody will be able to leave these properties unless the securities. And critically important to note that our regulations are strong, and anyone who violates these regulations will have to be penalized, we have such examples. We have had, as stated earlier by Mr. Henry, someone attempted to violate, and this individual is now in quarantine for 14 days. So St. Kitts and Nevis, we have a very strong and robust systems when it comes to quarantining individuals, and we don't intend at this present moment to lower our standards as we have them right now.
I just want to add here, though, that going into quarantine or being placed in isolation is not going into maximum security prison. And so someone can go into quarantine, someone can be placed in isolation, but if they're not responsible, they can find ways and means of getting out, despite the fact that there's a security guard out there. And so we are appealing to people's conscience. We say that to thine own self be true. And so when you're placed in quarantine, even if there's not a security officer out there, you need to obey the rules and regulations and stay in place. And so the same way someone can break out of a maximum security institution, there's the same way someone can break out of quarantine. But we're calling upon all of society also to help us. So if you know that somebody came off a plane today and they're supposed to be in quarantine, and you see them walking down the road 2, 3, 4, 5 days later, or 10 days later, or even 13 days later, then you need to report that to the authorities, and so that we can put these persons back into isolation and do the necessary contact tracing. So we're calling upon everyone, not just the security forces, to help us to contain the spread. Thank you.
Thank you, Dr. Wilkinson. This next question has to do with the vaccine. With a potential vaccine on the horizon and St. Kitts and Nevis signing on to receive such, what measures are being put in place for storage of the same? I know, Dr. Laws, you mentioned it has to be stored at a particular temperature.
Well, first let me mention about the availability of the vaccine before we go on, because the World Health Organization believes that everyone, everywhere, should get a vaccine once it becomes available. And that is why we have the Global Alliance for Vaccine that procures the vaccine on a global scale, and we have signed on to this to make sure that when the vaccine becomes available, it will be available to everyone. And when the vaccine becomes available, of course, it's going to be prioritized, and so those who need it first would get it. So it will be prioritized first to the first responders, because those are the persons who are at greatest risk for exposure. Those who have the greatest risk of dying from the vaccine, so the elderly and those with pre-existing conditions. And yes, the CMO mentioned that the virus has to be maintained in a cold chain, and of course, once the vaccine becomes available, we'll make sure that we have the necessary cold chain to keep the vaccine viable. Thank you.
Okay, that question about the storage was from SKN Vibes. There is another question in terms of government quarantine, and if there's sufficient space at government quarantine facilities to accommodate the passengers coming in, bearing in mind that quarantine is for 14 days and you have flights that are coming in with passengers. Is there enough space? Because some people may not be able to afford quarantining at their home and paying for the security that is required.
Thank you, Mr. William, for that particular question. And this is something that is an ongoing discussion. For example, we are seeking more partnership with individuals who deal with real estate, and they have villas, apartments available. For example, we have received 41 more rooms in a particular area for quarantine purposes. Another institution offered 30 more rooms for quarantining. And we are also engaged in other areas for persons to provide us with more space. We could never have enough space, Mr. Williams. We are also looking at the possibility of other systems to help us to monitor individuals, but at this time, we really don't want to go to that route. The reality is people are asking whether we are going to go back to home quarantine or not. And at the present moment, in discussion with our health teams, they have advised that that is not the best way for us to go right now. So that is not an option right now, but we are looking to it for the future. At present, I think that the adequate space is there, and we will continue to look for more space in order for us to facilitate persons coming in. One of the things, for example, that we have been advised is that most tourists and visitors who may come are coming for just 7 days, and we are already starting to see the trend of the 7-day. But our nationals who are returning, that is where we are seeing some of the greater numbers. So we will continue to create the necessary space that we need to in order for us to manage. What we are asking our citizens and residents is to bear with us as we need to go through this first phase and observe and see how things will go to help us prepare for the second phase going forward of this reopening.
This is our final question for the day. What happens if an arriving passenger does not have a device through which they can download the COVID-19 tracing app, or for some other reason they simply cannot do so? Case in point, there are persons who simply do not own a smartphone. Now, this is persons who are few and far between, but anyway, it's still a question.
All right, thank you for that interesting question, Mr. Williams. I think I begin by saying that there are very few persons without a phone, because even the young ones, the very young, and even the older ones, they hold on to their phones. So there are very, very few persons that would fall in this category, but that's not an issue. We would monitor them just the same. They will be, checking into one of the accommodations we would have highlighted. And then the purpose of the app is really to help monitor the individual to make sure they remain within, that setting. And so there are other security measures in place to help in that regard. And then the other aspect of the app, it's a means by which the individual can provide the health team, daily updates as to their health status. So if they begin to exhibit signs and symptoms of COVID-19, they can communicate that to the health team. And so there are other avenues within which this can be done. So, not having a smartphone doesn't hinder our achieving the same things. Thank you.
Thank you very much for that response, Dr. Laws, and I suppose that a lot has to do as well with whoever is monitoring the app and all of that, because they too can make errors in terms of their monitoring, and that can spell disaster as well. Thank you very much for your questions for today, and I do hope that you're satisfied with the responses that were provided. Of course, you can always ask a follow-up question or call somebody on the COVID-19 National Task Force to get clarification on anything that you would like clarified. I do want to thank Superintendent Henry for his presentation, our Chief Medical Officer, Dr. Laws, and Mr. Samuel, who is the chair of the COVID-19 National Task Force. Our medical chief of staff at the Joseph N. France General Hospital, Dr. Cameron Wilkinson, who continues to provide his support here at the NEOC, particularly in answering many of the questions that you pose. I'm saying doctor here, Mrs. Christmas Jacobs, for providing the sign language support at this NEOC briefing, to the media, ZIZ, and all who continue to partner with us in providing reliable and accurate information with respect to the management of the COVID-19 pandemic. This is not a time for us to have fear-mongering and all of that. It is a time for us to be responsible. And to Ms. Vesta Southwell for her continued support here at the NEOC. Thank you very much to all of you for joining us for today's briefing. Next week, we will be back on Wednesday with another briefing. Until then, I am Les Roy Williams. Take care.
Is on.